being a psychologist, it was a kind of a circuitous route for me to even be a psychologist. Um, After I got out of the Air Force, and I had a lot of problems in the Air Force, I'm glad you had a good time there. I had 2 congressional investigations for racism and my own sit-in demonstration because they said they were going to take my stripe and give it to a white boy, and they ended up giving it to a Hispanic guy. So at any rate, and they didn't ask me to re-enlist. You know, they usually ask everybody to re-enlist. They didn't ask me. You know, I came up right at a time of a lot of civil rights activities from 1962 to 1966. You know, so I was in the Air Force when Kennedy was killed, and so there was a lot of tension. There was a lot of things going on when I was in the Air Force. They had me in Michigan for almost my entire 4 years after basic training, and they wanted to send me to Vietnam. And this was right around the time that Muhammad Ali was being stripped of his boxing license, and so they wanted to send me to Vietnam. And I had like 5 or 6 months to go in the service, and now you want to send me to Vietnam for 90 days. And of course, I didn't want to go, so I told them I'm not going. You know, and they said, why? I said, because Vietnamese never called me a nigger. I'm not going. And I didn't go. The other thing that I think is useful to know, not necessarily important, is that they had told my mother I was mentally retarded when I was in kindergarten, you know. And just in case anyone's wondering, I'm not retarded, you know. I'm doing okay, you know. When I started high school when I was 12 years old in a Catholic high school in Boston, where I was the only black in the school, and had a good time, you know. So that was not a problem for me. But my nun, because back then we had nuns, you know, with the habit, and all you could see was hands and a face. You didn't really know if there was anything else in their body. But my homeroom teacher said any college that accepts you is hard up, you know. So, I say that, you know, not because I'm trying to garner any sympathy or anything. I say that because you're going to have a lot of obstacles in your way too. And there's going to be a lot of people that tell you that you can't do the things that you can do. You know, and it's going to be your choice in terms of who you listen to, who you choose to believe, because there's always going to be somebody that's going to say something to try to pull you down. And so when I came out of the Air Force, my mother was hit and killed by a white male driver, you know, and I just went off, you know, and I got involved in criminal activity. And I had never been a juvenile delinquent. I mean, I was a virgin until I was 18, you know, because, you know, the Catholics, they really indoctrinate you with the idea, don't have sex, don't have sex. And I was believing it, don't have sex, okay. I was a thief, mostly. I was a thief. I was a pimp and a thief, you know, and that's what I did, you know. It was just sort of a thing to do at the time, you know. I know you're looking at me saying, why would anyone give that man any money? At any rate, you know, I ended up getting a 2.5 to 3 year prison sentence because it was nonviolent. I was a nonviolent kind of guy. So I went to school and I was studying aeronautical space engineering. I was in the Air Force. I had been in the Air Force, and I decided that I want to be an astronaut. And then I ended up going into criminal activity, so that kind of stopped that. My mother died, and I was distraught, and I was all to pieces. Before I went to prison, I was working as a stockbroker trainee, because I said, I want to be rich. Who's got the money? You know, does money flow from the East Coast to the West Coast? From the West Coast to the East Coast, and I figured it flowed from the East Coast to the West Coast with the stock market, you know. And so I became a trainee for selling mutual funds. But then the following week after I got that job is when they sentenced me, and I had to go to prison and do my time. I come out of prison, and it was a time of affirmative action, you know. And the black Muslims in Boston got me into school so that I could do that, but the only school they could get me into was the College of Pharmacy. So I'm going to the College of Pharmacy for a couple of years, and then I found psychology. Now, I didn't get into psychology because I wanted to help you. That's not why I did this. I wanted to help me, You know, I wanted to figure out why I did the things that I do. Graduated, got my first job, you know, as the clinical director of an adolescent treatment facility. This was when Governor Dukakis in Boston, you know, decided to separate adolescents from adults in the state hospital system. And then I had done a lot of work in the prisons. I had done, you know, group therapy with drug kingpins. They would put me in a room and lock me in a room with 10 murderers. And I was okay with that, you know. And the only time that I reach something, and anyone that is thinking or contemplating going into psychology, it is good to know your limits. Your limits. You know, I worked at the Bridgewater Treatment Center for the Sexually Dangerous as part of my postdoctoral internship, and this used to be an internment camp for Confederate soldiers, captured Confederate soldiers. And a lot of and it was a place called the treatment center, the Bridgewater Treatment Center for the Sexually Dangerous. These are men that rape and kill their victims. And this is where I ran into my first limit, you know, because you can't do any therapy with anybody if you have no empathy for them. You've got to have some sort of empathy. There's got to be something about it that you can relate to so that you can connect emotionally with them. The curative factor in psychotherapy, you know, is for them to be able to connect to you in a way that allows them to take out their frustrations on you, right? We call that transference. That's transference. Countertransference is how I feel about you, you know. Transference is how they feel about me, which means that there are times when I have been a white man, when I have been a woman, I've been a black woman, you know, I will be whatever you need me to be so that you can take out your frustrations and therefore be helped. That's the way the process works in a nutshell. That's a little tiny way of understanding of how this whole psychotherapy thing works, you know, because psychotherapy is not designed to cure you. You know that, right? It's not designed to cure you. Psychotherapy is designed to make you feel less bad about what you feel bad about. That's what it's designed to do. So anyway, I was frustrated because I worked at the Bridgewater Treatment Center for the Sexually Dangerous because I was getting a headache every day. I was getting a headache every day because I was dealing with men that rape infants and split them, you know, and that was more than I could handle. Because don't forget, doing this work, I have to listen to all the intimate details. So at any rate, I came here to Virginia, and my first job was at Eastern State Hospital, you know, which is the oldest state hospital in the country, Eastern State Hospital in Williamsburg, you know. So I came there, I was at the lowest level. When I left, I was the acting director of psychology. While I was there, I took training at UVA in Charlottesville, you know, at the Institute of Law, Psychiatry, and Public Policy, you know, and that's when I became a forensic clinical psychologist, you know. So I did that, and then I left Eastern State Hospital and opened up a private practice, and so I have been doing forensic psychology along with, you know, clinical psychology ever since. It is unethical for me to try to bend the facts to fit anybody's case, you know. So even though I am generally hired to do something for the defense, you know, I mean, I do it for the state. I will do my evaluation, and it's up to the lawyer if they want to use it, you know, because my evaluation may not help his case, you know, but that's not my job. My job is just to do the evaluation, you know. It's the lawyer's job to decide what he's going to do with what I say. The primary things that I do are the same things that Dr. Bill said. You know, I do competency to stand trial. You know, so what that actually means is, do you know enough about courtroom procedure to aid your attorney in mounting an adequate defense? That's really all it means. So I'll ask questions. What is the job of a judge? What is the job of a prosecutor? What is the job of a defense attorney? What does cross-examination mean? What is a testimony? So these are the kinds of basic kinds of questions that you would probably know just watching television. There's a difference between being mentally ill and having a mental defect. We don't have a treatment for mental defects. There is no medicine for mental retardation. There's medicine for schizophrenia, bipolar disorder, and other psychotic disorders, but there's no real medicine. And let me tell you something about those medicines. They don't cure anything. We ain't curing nothing. Nothing. Matter of fact, a whole lot of times psychiatrists will try different medications because they're not sure of what the problem is or what's going to work. So they may try 3 or 4 different medications, in 3 or 4 dosages, to try to help somebody. And then you got the problem of medications that are designed for adults that were given to children, right? So you have attention deficit hyperactivity disorder. That medicine was not designed for children. But who do we give it to most? Children, So they just try to kind of guesstimate and titrate it down, and go by your weight and say, okay, I think we can give them this much or that much. So a lot of it is a guessing game. And psychology is a very inexact science, So, it has more to do with opinion than anything else. So that's kind of what competency is and what I do with competency, The other part is that I get called on to do the most, because there are a lot of different aspects of this, as Dr. Bill has said, but usually I'm only asked to do a competency and a sanity at the time of offense. Now, sanity at the time of offense could be kind of tricky because by the time I get an individual, their case may be a year old. Now, I got to figure out what you were thinking and what you were feeling a year ago. That's my job, for sanity at the time of offense. Sometimes it's easier than other times. For instance, you have someone with a legitimate mental illness diagnosis, schizophrenia, for instance. And we know at the time that I might know at the time that this individual with schizophrenia was non-compliant with their medication. And they were doing other things that gave me some indication that they may have been psychotic. Oh, I was hearing voices. Of course, anyone can say I was hearing voices, because it's going to be, as he said, sometimes some malingering. People think they're going to get away with something, if they can get what we call an NGRI, not guilty by reason of insanity declaration. So I might say, well, what are the voices telling you? Well, the voices told me I really shouldn't do that. I really should do this, That's really, really, really not the way auditory hallucinations go. They don't say anything positive. You got a person that's claiming to be insane. Maybe they were insane, maybe they weren't insane, and because not everyone that has schizophrenia is necessarily insane at the time of the offense, right? You can be a schizophrenic and you can still know what's going on. What a lot of people don't understand is that no mental illness is 24/7, 365. A person with schizophrenia is not insane every single day of the year. They'll have days that they are clear. They have days that they are not so clear. They'll have days that they can be mentally ill, but still know what's going on around them, still know the difference between right and wrong, still have the capacity to maintain their behavior within the limits of the law, are the kinds of things I'm looking for in a sanity. That's my idea of how the whole insanity thing works. I'm trying to figure out 6 months ago or a year ago what you were thinking or feeling at that time of your instant offense or your current offense.